like to push it up there, Ash?
Yeah.
Yeah.
We'll see how we go. Oh, my God. What, wherever you are.
Good afternoon.
Hello there, how are you?
Good, how are you?
Yeah, good, thank you.
Is it Mark and Ashley?
Yeah.
Great, if you guys just want to take a seat there. Should be out in a minute.
Thank you.
How's your guys' day so far?
OK, thanks, yeah. This is the highlight of the day, really. I lost my leg 2 months ago. I'd,
Also quite recently?
Yeah, 2 months. It was so rapid, so quick, didn't know. I was working and I got like a little sore on my foot. And within a week, it turned into an ulcer. And then I caught sepsis. And it completely destroyed my foot. So I had to have an emergency. I was taken into hospital on the day. The sepsis had gone through to the bone. They said unless we remove it, it'll go. Once it hits your groin, it'll kill you. It was 12 hours away from it taking me, so it was.
That's so quick.
Quick. It was unbelievable.
Doesn't even give you time to wrap your head around it.
No, nothing. Yeah.
Mr. Davis, would you like to come through?
Thank you.
It's a bit of a squeeze here. I've moved the trolley away from you.
Thank you.
You're all right there?
Fine, yeah, fine, thank you. How are you?
Not too bad, not too bad. I was just reading a bit about you because of what you've been through, the surgeries recent in August. Yeah, what can I do for you today, Mr. Davis?
Right, the last week or so, I've had this, like, a swelling. It feels as if it's, when I lie down, it feels as if it's fluid. It's not solid.
Okay.
But it feels like, as daft as it sounds, as if something's moving.
Okay. So when you're sitting up in the chair, you can't feel it, mostly when you're lying down?
When I'm lying down, and then it'll go, there'll be nothing. Like now, it's typical now, I can't feel nothing.
Yeah.
But then sometimes it'll just sort of like it's inflating.
Yeah.
It's tender. I wouldn't say it was painful. It's tender rather than me being, it's agony.
Okay.
Yeah,
we'll have a look. So with the surgery for the amputation is secondary to diabetes, sepsis, isn't it? The foot was septic. They had to do the amputation. You had your spleen out before, did you?
Yeah, 6 years ago.
What was that? What was that?
I had pancreatitis, acute pancreatitis.
Gosh, yeah. You've been through the wars.
Yeah. If I was a soldier, I'd probably get a medal.
But you could still have a smile on your face.
My phrase is now, sink or swim.
Yeah.
No, I'm a swimmer. I'm not gonna let it beat me. I'm determined.
Exactly.
How's life?
Life's good.
Good?
Life's always good.
Good, that's nice to hear.
I'm sure they enjoy having you in hospital.
Oh,
I imagine you keep spirits up.
Yeah, we haven't.
You're only here once.
Yeah, absolutely.
Always say if you're above ground, life's got to be good.
I like that saying. Okay, that's a nice positive spin. I like it.
Well, I had a lovely lady come and tell me all about her bipolar disorder and her years and how she's coped. I mean, she was phenomenal. I mean, the coping strategies she's developed over time and the insight she has.
It's great meeting you. You're definitely an inspiration, I think.
Life's too short, yeah, so do the things you love. Do the things you love all the time.
How long have you had type 1 diabetes? How old were you when you were diagnosed?
It was only 6 years ago.
Oh.
Yeah, because of the pancreatitis.
Yes. Yeah,
and they still can't explain why. Obviously, the main thing for that is alcohol.
Yeah.
But I don't drink.
That was the bit that actually caused lots of these problems, isn't it? The pancreatitis.
Yeah.
Mark doesn't fit the typical patient type that would develop acute pancreatitis. He's actually quite fit, quite healthy. He doesn't drink. He's not overweight. I had initially thought that he's had type 1 diabetes for many years, but it seemed that despite his clean living and no apparent risk factors, he developed acute pancreatitis not too long ago, which actually caused him to have the type 1 diabetes, subsequently putting him at risk of all the other further complications. I need to have a good feel of your belly. How are we going to get you on the couch?
Yeah, I can.
You think you can? Yeah. Let me try.
You can do anything, can't you?
That is the spirit. Diabetes is a very complex condition. I mean, long gone are the days of us thinking of it as just a purely sugar problem. Its major risks are actually vascular. It affects your peripheral nerves. So that is the sensation supply, especially to the ones to your feet. So a slight nick in the skin, an untreated fungal nail infection, for example, can lead to gangrene, sepsis, and in Mark's case, an amputation.
The instinct is to put your foot down.
Exactly.
You still can't get used to it.
Are you getting any phantom pain?
Yeah.
Really?
Oh God, yeah. It's,
really?
I don't mean it to sound funny. I find it more comical than anything. You sit there every night and you go, God, I feel like somebody's got your foot and they're doing that to your foot.
Yeah.
Squeezing the toes. And I'll go, oh, there's nothing there.
Yeah.
Or like I've rolled my ankle because I used to play a lot of sport.
Yeah.
And I've gone over on my ankle's sore.
Yeah.
I'm thinking, well, it can't be because I haven't got an ankle.
Yeah.
So it's, you know.
That's what's bizarre, isn't it?
It is.
So are you able to shove your bottom there?
Yep.
Okay.
Okay.
Okay, and lie down. Is it this bit here that you feel that it's...
Yeah, that's it, yeah.
Okay. Are you able to perhaps lie on your side towards me?
Yeah.
So that we'll see if it's fluid, it will shift downwards, you see.
Yeah.
There is a little bit, isn't it? I agree.
Yeah.
I think we need to have an ultrasound scan just to make sure that everything's okay. Because you've had so many things done here. So we just don't want to miss something else. Nothing nasty, but not much, just a small collection of fluid.
Yeah.
Let's get you up and then we can discuss what else we can do.
Thank you.
Do you need this stool?
Yeah, thank you.
Perfect.
Yeah,
okay.
thank you.
I agree there's fluid because when you shift, the fluid shifts in your tummy cavity. I'll get the referral done. You'll get an appointment in the post.
Okay.
Okay.
Yeah.
But in the meantime, anything in the area, come back and see us before.
Yeah.
Okay.
Okay, thank you very much.
Thank you, Doctor.
Mark's an amazing person. I was amazed at how remarkable his coping mechanisms were.
Thank you. Bye.
It is so difficult to make changes in your life after something such as an amputation. I think what's really important is your mindset, realizing that you're not going through this alone and there's lots of help and support out there.
I really like your glasses. They're really cool. Are they new?
Yeah, I used to have ones, you know, like the black, like Harry Potter.
Okay.
But then these ones have like come in now.
Yeah, they're a bit more summery.
Yeah.
No.
I used to have like purple and black, but you could tell you've got glasses on.
Right.
Where these they look more like
something more subtle.
So, yeah.
Joanne, flex
Hello.
Hello. Hi, Dave.
Coming in, yeah?
Yeah, come on through. Sorry, you'll have to squeeze in there. Come and have a seat.
Yeah.
Well done. Hiya.
Hi.
How are you doing?
I'm okay. How are you?
I'm good, thanks. Yeah. Getting on. So what are we talking about today?
So I think from probably Saturday night, Sunday, I've been getting like a sharp pain in my back that comes through to the chest. But I kept getting pains for like every 10 minutes that lasted like 5 or 6 minutes, like a sharp dull ache.
So how long did you say this has been going on for?
So I think I started to get the pain either Saturday night or Sunday, but then I went for a walk Sunday with my friend and she said, you sound like out of breath. So I feel like I'm out of breath
And
as well.
so you're out of breath as well.
Yeah.
So you've got some sharp chest pain that you've had for 3 or 4 days.
Yeah.
And then you've got some new breathlessness as well, have you? Yeah. And do you notice that are you more breathless when the pain is bad, or is the breathlessness just there all the time, or what's going on with that?
So I feel breathless now. You know when you go like to take, I feel like I struggle to take a deep breath at the minute.
And when you take a deep breath, does it hurt?
It's just like an ache, like a dull ache. Yeah, it's not sharp.
No,
it's
but
just
does
like as if I'm...
Is the pain worse when you take a deep breath?
Not really.
Not really, but it's just that it's there in the background.
Yeah, you can.
Okay.
You know it's there, like a dull ache.
Do you mind slipping your jacket off? Right, let's pop that in there.
We walked around the park and I could tell walking up I was breathless, but I didn't say anything. It was like
That's
they
normal.
said it,
Yeah, did they? Well, your oxygen level's okay and your pulse isn't too fast, which is a good sign.
Yeah.
but it doesn't mean that you're not feeling breathless. Can I just get you to roll your sleeves up, because I'm going to do your blood pressure. Right, pop your arm in there. Just like that. Can I press on your chest?
Yeah.
If I press, what does that do? That doesn't do anything?
No.
So it's not being brought on... I know I'm pushing quite firmly, but it's not bringing the pain on worse.
No.
Can I press on your back as well on the same thing? That's not bringing it on?
No.
Can I put that down there?
Yeah.
That's it, nice deep breath. Your chest is nice and clear. Right, so that is lovely and normal. What I'm going to do is get you to go and do a little bit of a walk around. Can you just go out to the car park and just get yourself a little bit out of breath?
Yeah.
But with this on, so that I can just monitor your oxygen level.
Okay.
Is that all right? Yeah, so pop that back on. And then we'll get you to go and have a little bit of a pace around, just to see if we can get your breath...
a bit breathless.
Get a bit out of breath. And
So just try and walk up the hill or something.
yeah, a little bit around the car park's probably fine, isn't
then.
it? But just see if you can go and have a bit of a pace about.
Do you want me to come back in about 2 minutes?
Yeah, and then that's fine. So just, I'll come.
Okay.
Is it raining? Right, just go and have a quick pace about.
This is weird.
I know, sorry.
Hello.
Hello.
How was your morning?
Oh, interesting.
How was your patient that you just finished?
That last one was really interesting. You know, he's had below knee amputation in August, but such a positive man. Honestly, he is just amazing.
So he's in a wheelchair now?
He's in a wheelchair. He's had assessments and things for a prosthetic leg, and but the nice thing was he's just transferred to a new job. Job's okay for him.
Oh,
They said it's fine. He's trying to get his car adapted. Such a lovely man, so positive.
Yeah, I think that helps, doesn't it? Yeah, just kind of. I guess things happen that happen very, very quickly, and it's hard to mentally accept.
And he said it happened so quickly in a way that he was thankful he didn't have to think
dwell on it too much.
Yeah. But I'm worried that in case it was going to hit him, because he's just going through the motions now.
Yeah, although things are happening very quickly, that is part of of accepting that your life situation is different. You know,
and it's good that he's doing those changes rather than sitting at home moping.
Thinking about it too much.
Because the thing is, you know, why should life just end?
Yeah, you shouldn't.
Yeah.
That'll do, you can come back now. Well done, come on back in. Have a seat. So that just gets your heart racing a little bit, and we see whether your oxygen level drops when you've been pacing about and it doesn't, which is a good sign. So it's a bit of a mystery, because when I listen, your chest is lovely and clear. When I check your oxygen and check your blood pressure, actually everything is looking pretty good. Normal. That's great. Your temperature's normal, and that's quite reassuring. But on the other hand, I can't say why you're getting this chest pain and breathlessness, and that's a little bit more worrying, because sometimes you're right. If you Google things, you'll discover that there are some things that can happen that are more serious that can cause chest pain and breathlessness. And on that basis, I need to get some more advice from the hospital probably about what we should do, because I think that it would be a good idea to go and see them and get some more tests, and we need to do them a bit more urgently, just because it's a bit odd and I can't quite get to the bottom of it. Chest pain and breathlessness are potentially serious problems. There are quite a lot of nasty illnesses that can cause those things together. That means that the doctor's got to be really sure that we're not missing something underlying all of this. The things that would drive me to send somebody to hospital would be to make sure we didn't miss a blood clot in the lungs. That's called a PE, or pulmonary embolism. That's a potentially life-threatening blood clot. The other thing is sometimes a split in your major blood vessel, the aorta, can cause chest pain and breathlessness, and that would need to be excluded too. Okay, so I don't want to panic you about all of that.
It's fine.
And it's reassuring that your oxygen doesn't drop.
Yeah, it's just the acheness and the pain.
I know, and it's all those things
together. If I never had those, I wouldn't come.
Exactly. And so I think what I'm going to do is get you to go to the hospital this afternoon.
Okay.
They will do all their tests and be able to give you an answer one way or the other.
Yeah,
but there are enough red flags in the story that's just making me think we need to get that reassurance, as I said.
Yeah, okay.
Is that all right?
Yeah.
Fingers crossed it'll be all right.
I've got to look after myself,
You
haven't
do.
I?
You do,
So,
and that's the right way.
Okay, thank
All right,
you.
cheers then.
Thank you.
What can I do for you today?
I've only ever been to the doctors once before with the feeling of just complete and utter loss. I've been going through a very difficult time the last 7 years of my life because I split up with my partner.
I'm sorry.
We've got 2 children, which I absolutely adore. And I've got a fantastic relationship with my kids. My 15-year-old boy will still come and give his dad a cuddle and come and talk to me if he's got any issues, that type of stuff. Since my marriage breakdown, unfortunately, because I had to sell my family home to support my wife and kid, my ex-wife and children, obviously I went into rented accommodation because I thought it was going to be a blip. But I've never seemed to be able to got out of that, and that depresses me in itself because I bought my first house when I was 18 years of age, and I feel lost because it's not my property. It's toll on me as well because I feel like I'm gripping at the ladder and I can never seem to be able to get back to the top.
So how has this affected you
I'm not sleeping.
health-wise?
I'm not sleeping. I woke up at 2 o'clock this morning and do you think I could get back to sleep? No way on this planet.
Mood-wise, feeling low?
Yeah, I feel lost again.
Lost,
because
yeah.
I think another thing I sort of struggle with as well, and it's not because I'm trying to be sexist in any way, there always seems to be help for mums. And as a man, I don't know where to go sometimes.
Yeah.
I you know, there's... Yeah,
And that's why, you know, the single fathers movement was a big thing because they were fighting for that because, you know, historically the children always ended up with mum and then the mums get help, you know. And I think,
And you can make you feel pretty... Sorry, it can make you feel pretty worthless sometimes. Because I stand my ground, I am a good dad. And my kids will tell you exactly the same. They will say to you, Dad, you're a good dad. Because they do sense when I'm down.
I think with men and mental health, they don't normally book an appointment.
Yeah.
I know it's, you know, when they come in, a lot of my patients would say, it's my wife who told me to come in.
Often they say that men don't seek help when it comes to mental health issues, and there's all that culture around sort of being macho and stuff like this.
How are you doing with it all?
Just, generally coping as best as I can.
I attend psychology group and I attend a few mental wellbeing groups.
Go and walk the dog in the morning.
Yep.
And then I go and play 9 holes of golf.
Okay.
Because that's my own time.
As well, remembering that there's never any judgment when you come here. It's actually people want to help.
Yeah.
But I know it can be difficult to say things aren't going well.
It's good that you're talking about this stuff, especially as a bloke. It's not always easy.
Yeah, it's not easy,
Thank you very much.
It's okay for men to cry, and I think that's the thing, you know, in the traditional roles where men are supposed to adopt stiff upper lip because they're strong, they're supposed to be protectors to everyone else.
We're all
it's really
equal.
bad, yeah.
We're all equal.
And then we bottle
We are
it
all
in.
equal.
Yeah.
It doesn't matter whether you're a man, woman, child, we're all equal. We've all got feelings.
100%.
We've all got a heart.
Yeah. And you know, it's good to share it sometimes because the worst thing is to bottle it up and not acknowledge it.
Yeah.
It's perfectly normal for men to cry. I think this is based on, you know, historical stereotypes where boys are supposed to be tough and not show their emotions. The crying, being sad is actually part of human life. Women, we are more social animals. We love to offload our problems to our friends and our loved ones. And as a result, there's been lots of campaigns, charities out there trying to promote men's mental health and well-being. In medicine, we normally offer talking therapy or tablets. Those are the two things. Talking therapy would probably be the best for you.
Oh, yeah, I'd rather talk than take a tablet.
I'll get the referral done. In the meantime, whilst waiting for the talking therapy, if you think your symptoms are getting worse, and if it comes to a point that you need tablets, it's not the end of the world.
No, it's not.
You know, I always use the analogy. People have heard this many times before. You wouldn't apologise to take, you know, tablets for a broken leg, or
That's
you know,
right.
people don't come in and say, "I'm really sorry, I don't want my inhalers because I've got acute asthma attack." So we treat it the same. But I agree. I think in this case, the talking therapy is better.
I just want somebody that I feel is looking out for me.
Yeah.
Do you understand? Does
We
that
will.
sound
We will
silly?
look out for you. No.
That means more to me than anything else.
Yeah.
Oh, he's just a dad.
Yeah.
Well, no, I'm not just. I'm a human being.
Yeah. Yeah. Who's got lots of vested interest and emotions tied with your kids. These are your children. Okay. These are not random kids. Leave that with me. But thank you for opening up.
Thank you very much. No,
thanks for coming.
Thank you for your time. Oh.
Take care. Mind you go.
Thank you.
Bye-bye.
Oh. Cheers, fella.
Thanks, mate.
Hello there.
Hi, how are you?
I'm with the doctors.
So brilliant, perfect. Excellent. I believe you're here to see Dr. Pelly. If you'd like to just take a seat.
Thank you.
Robert?
Yeah.
Come on through.
Thank you.
Morning.
Good morning.
Come and have a seat.
Thank you. Thank you.
How are things?
Just recently, I've started having a problem with blood from the anal passage.
Oh.
And it comes and goes.
Right.
But when it's there, it doesn't seem to want to stop.
Oh dear.
It does, but you're talking about 15, 20 minutes.
Gosh. Yeah. And how long has that all been going on for you?
I've had piles for years, but that sort of disappeared a few years ago because I've had bowel cancer, and that cleared in 2013. I've just had esophageal.
Reading about that, you've had a torrid time. Have you been worried about it? Have you been thinking it's something in particular?
Well, no, I was thinking hemorrhoids, but
this seems a bit different from normal.
Yeah, and I'm afraid my underwear's getting soaked through, and it's soaking through into the bed as well.
Yeah.
So.
And is it just when you go to the toilet, or is it happening afterwards?
No, it's happening when I go to the toilet, but then, of course, it's not stopping straight away.
Sure, OK. Have you had any pain when you go to the toilet?
No, it's not painful. Yeah, it's uncomfortable.
And are you getting blood mixed into the poo at all?
No, I'm checking my poo because obviously I'm in bowel cancer. I do it regularly anyway,
Sure.
and I haven't noticed any blood in the poo.
Probably what I think we ought to do is have a look, if that's OK, because I'd like to have a look and see whether I can see a pile or a cut there that's causing the blood. If I can't, then I'd like to do an internal and check that everything is OK inside. Is that all right?
Yeah.
Can I do that now?
Yep.
Yeah. Have you had it done before? I imagine that you've been through this before. If you if you just lie on.
It's perky getting older.
Oh dear, yeah. So if you could just lie on your side facing the wall.
I got a new jumper.
Is that one?
His jumper got wet. We've been jumping in puddles, so he's had to have a spare one on.
I have one that looks exactly like that.
Hello, you okay?
Hello.
Hello, young man. Do you want to grab a seat there? And if Mum sits there. Hello, do you want to sit here?
Sure.
Yeah. Okay, how can I help you today?
Saturday night he had a temperature.
I have a cough now.
And he's got a really sore throat and a cough. I can't work out if he sounds chesty or if it's all in his throat. So I just wanted just to check in for me really, just to see if he needs anything. And when he's coughing, he's got like mucus. He's coughing up mucus.
Have you noticed a colour with it?
It's like a yellowy clear. It's not
clear yellow.
Yeah.
Rather than like the green, thick green.
It's not been green, has it?
It is green.
It is green sometimes.
Okay, maybe it's green.
Maybe it's green, yeah. So his temperature was on Saturday, and has he been fine with the temperature since then?
I think he feels warm now because I've given him some medicine before he went to school this morning, and he's had nothing since.
Did you have breakfast this morning? Yeah. What did you have? Do you remember?
Chocolate.
For breakfast?
No, at Breakfast Club, chocolate hoops.
Chocolate hoops.
I know.
It's a whole different conversation. Yeah. Okay, chocolate hoops. That's all right, isn't it? Yeah. Did you eat all of it? Yeah. Okay. If you slip your jacket off for us.
I have a hole in mine. I have a hole?
He's got a spare jumper from school because his jumper got wet, so
Yeah.
they've put a spare one on. It's got a hole
You
in,
got a hole.
and he's not happy
Don't
about the
worry.
fact it's got a
You know
hole.
what? I know how you feel, and I'm not judging. Don't worry. It looks quite cool though. How did your jumper get wet then?
Jumping in muddy puddles.
Yeah. You know, I got a feeling you're the kind of kid that jumps in muddy puddles. So his temperature is up at the moment.
Yeah,
It's
I do think he feels warm.
38.3. And wide open. Wide. Don't worry, I'm not going to do anything. Just say, ah. Good boy. Come this way. Let's have a look in your ears. In your ears. Let's see what we've got in here.
Lots of wax, I bet.
Nah.
He has clean
Let's
ears,
see.
don't you?
Let's see what you got there. I think I can see carrots and potatoes, Sunday roast, all of that stuck inside your ear.
Oh, he's actually looking.
Okay, if you just turn that way, I'm just going to lift this up.
Yeah, that's fine.
Up. Just go like this for me. Can you go through your mouth? Another one. Like that. Good boy. Another one. Okay, that's fine. Throat looks fine. A little bit red, but there's no tonsillitis that I can see.
Okay.
And his ears are fine. Okay. And his chest actually is clear. So he's coming across as a viral type illness. Really, it's about managing, making sure his temperature is managed. And that's not just by giving Calpol, but it's also making sure he's got a bottle of water. He's got to drink it, he's got to drink the water, keep hydrated, get that temperature down. And then when he gets home, just strip the jumper off, get the clothes off, and then just it's getting really cool. Okay. It's not outrageous temperature of, 39 or whatever. It's 38.2, which is it's high enough to make him feel unwell.
Yeah.
Is that all right?
Yeah, lovely. Thank you.
Okay.
Thank you ever so much.
No worries. Yeah, you can jump off there, yeah?
Thank you.
No worries at all. Thank you very much.
Thank you.
See you. Bye. Bye, Cooper.
Bye-bye.
Bye.
Bye, nice to meet you.
Bye.
Thank
See
you.
ya.
Thanks.
Mum, am I getting my medicine now?
I've got to get some from the pharmacy.
So when I have a look down below, I can't see any obvious piles there. I can't see any cuts there either. And on the internal, I similarly can't find any lumps or any blood there on the glove when I'm checking inside. So it means that I can't see where the blood is coming from. And that obviously is something that we really need to understand, isn't it? My thought is that given that you've got ongoing blood, that we ought to do some tests to make sure that there isn't something more serious causing it. And that means a telescope test to look inside so that we can make sure that there isn't something like a cancer. And obviously you've been through that before. And with your background history of having had a cancer, that does mean that we ought to look at that with some urgency to make sure that there's not something there. Have you got any other questions about that side of it?
No. I've been through it.
You've been through it before. I will get all the paperwork sent through to you shortly.
Thank you very much.
All right, I
Doctor.
hope everything
Appreciate
goes okay for you.
And me.
How was your weekend? Did you get up to much?
Karaoke on Saturday.
Nice.
I like to party.
So how often do you do karaoke parties?
As often as I can.
Good answer.
Hello.
Yes.
Come on in.
Oh, see you in a bit. Hello, you okay?
Hello. What have you come talk to me about today?
My weight.
Okay.
I'd lost over 3 stone. I was doing Slimming World and I've been really good.
Mm-hmm.
And I've put 2 stone of that back on and I really need some help.
Okay.
My portion sizes have gone up compared to what because I was really strict.
Okay.
Even down to alcohol. I'd swap lager for, I'd have vodka and diet lemonade.
Okay.
When I had a drink, because I drink for the weekend.
How much do you drink at the weekends?
Saturday, I do have quite a bit on the Saturday.
Okay. How many vodkas are you having on the Saturday?
I'd say probably about, between me and a couple of family members, probably would get through a bottle.
Okay.
Of vodka, yeah.
Every Saturday?
Not every Saturday, but maybe every other Saturday.
All right. What about during the week?
No.
No. Okay. Alcohol is a big source for calories, so I'm sure you're probably aware of that. And to be fair, switching from beer to vodka is a smart move in that respect. Is there something there about having some structure to your diet, something that kind of helps you, like say, what you can and can't eat, and then sort of having the willpower to stick to that.
Yeah, because before I did have the willpower, and but it seems to have gone out the window at the minute.
Okay.
It's like when I go through stressful times, I end up eating and eating. I ended up at 15.5 stone because my mum died. Yeah. And to be fair, my mum died because she was over 20 stone and she'd got a lot of health issues and she had a stroke and suffered with high blood pressure, and I don't want to go down that road.
Absolutely.
Do you have any idea how much you weigh at the minute?
21.
21 stone, okay.
Yeah.
And what about your weight? Do you think that...
I'm overweight. I'm about 13 stone, so...
Okay.
How do you think we might best help you in losing weight?
I don't know. I really don't know.
I got down to 16.
Yeah, so how did you manage to do that? Because that's often really helpful. What worked for you
Cutting
that
the
time?
carbs.
Carbs, okay.
Yeah.
I have managed to lose a stone.
Well done. That's, not an easy task.
I can lose weight. Keeping it off is the problem.
Yeah.
Shall we see what you weigh now?
Want me to take anything off?
No, that's fine.
Okay.
I'll do that on 0. That's only fair. Right, okay.
That gives you a BMI of 34.4.
So that's fat.
Yes, sadly.
I think certainly we need to think about how we can help give you some better structure around your diet at the moment, isn't it? So one of the services we could probably get you referred to would be a dietitian. Someone could go through your diet with you and sort of help start putting some things in place to help give you better structure. Yeah. Most recently, have you ever done anything else in the past that's sort of helped you lose weight, which you felt was also effective?
Yeah.
Tell me about
Which
that.
I wanted to ask about, the tablets.
Which tablets are that?
Is it the all...
Orlistat?
Yeah.
Yeah, okay. Let's start by checking your blood pressure.
Okay.
Right, there you go. How did you get on with the Orlistat last time? Did it cause you any problems?
Just the usual, obviously. When you got to go, you got to go.
When you got to go, you got to go. So that's the point, right? So the Orlistat, the way it works is it stops your body from absorbing fat from your food, which means that if you have a meal which has a lot of fat in it, all that fat remains in your poo.
Yep.
And unfortunately, that can lead to some quite unpleasant side effects. Do you recall experiencing any of those unpleasant side effects? Yes. So Orlistat, whilst we can prescribe it to you, does need to be accompanied with a low-fat diet.
Yeah.
Great. Right, time for the weighing scales. At the moment, this says just shy of 90. Okay. Yeah. So what we'll do is I'll get you a referral to the dietitian, and then I'll do a prescription for some Orlistat today. There's a requirement around the Orlistat, so if we're going to prescribe it to you, we would like you to lose 5% of your body weight within the first 3 months. Okay? Just to put that into stones for you, that's about 3/4 of a stone over a 3-month period. So how confident do you feel you'll be able to do that?
Yeah, I can do it.
You think you can do that? Okay. All right.
Then.
Great.
Okay,
Lovely to meet you.
Yeah, you
All the best. Thank you.
Bye.
Hello, sir. Come on through.
Okay.
Okay. Thank you for waiting.
That's okay.
I'm Dr. Arif. How can I help you today?
My father
Yeah.
has a history of prostate cancer.
Right.
So I wanted to have a blood test to check my bloods, because I'm at that age where potentially I could develop the disease, perhaps.
Okay. Do you have any symptoms or anything related to prostate you're worried about, or?
Not really worried about symptoms. It's just that my father has mentioned it, and he's had an operation to have the infected area removed a number of years ago, and he's just he's kind of an advocate for that sort of thing, and encouraging us to get it checked and tested.
With prostate cancer or prostate problems, there are certain ethnic groups where it can be more prominent, and so the way it normally goes is African, Caribbean, population have the highest risk, then it falls into the Asian population, then it falls into the Caucasian population. Okay. So you are at high risk purely from ethnicity point of view. There's a couple of ways to check for the prostate. What we can do is, in general practice, is absolutely we could do a blood test, and that would give us an idea as to where your prostate level hormones are. Okay. And if they are above what they're supposed to be for your age, that would warrant further investigation. Okay. Now, the reason why prostate blood test isn't done across the country for every male who's over 15 doing a prostate blood test is because people who have prostate problems, including prostate cancer, can turn up with a normal prostate blood test. Right. So it doesn't always say, a normal blood test doesn't necessarily mean that your prostate is perfectly fine. Right. You see what I mean? I do. But it's still worthwhile to do one, at least it gives us some information. Okay. The other way of testing for a prostate is to do an examination. Right. Have you heard of that? I have, yes. Do you know what that involves? I don't know. Okay, so the only way to feel your prostate is by popping a finger in the back passage and directly feeling the prostate to see what it feels like. And we can get a feel for, is the prostate big or not? Is it smooth or rough? So we could put that with a PSA blood test and decide what we want to do further. Okay. Yeah. So what would you like to do today? Just arrange a blood test to begin with, I think. Start off with the blood test. Yes. Okay. Once you've had your prostate blood test done, if it's still something, I mean, really, we've already done half the work. The next step really is to do a prostate examination. Right. So really have a think about and prepare yourself to get that done. Okay. What I find with male patients who present with prostate issues or want to talk about prostate, like Lloyd, I think they don't quite realise that a prostate test doesn't just involve a blood test, it also involves an examination. And if people are coming to see us in our consultation and not fully prepared to have an examination as intimate as the one that we need to do to check your prostate, it's not uncommon for patients to decline. And our job is to explain the importance of an examination and give them the opportunity to book in the future to have that examination. So go to reception, get yourself booked in for that blood test. I'll put the request on here for you, and I'll get you. Just a normal blood test, or the prostate test. So tell reception you're booking for a blood test. I'll put into the record exactly what it is. Okay. They don't need to know in reception it's a prostate test. They just need to know a blood test. Okay. Is that all right? That's fine. Brilliant. Was there anything else I can help you with? No, that's it. Thank you. Okay, brilliant. Right, thank you so much, sir. Thank you. Let me get in the door for you. Thank you. There you go. Cheers. Thank you very much. Thank you. Bye-bye. Okay, bye. Okay. Excellent. Yeah, thank you. Bye. Okay. Nice to see you. Thank you. Have a good evening. Okay. Look after yourself. Okay, thanks very much. Cheers, bye.
Yeah. That was a good one.
Yeah, bye, love.
Bye-bye.
Look after yourself,
You too.
Hopefully things will improve. All right, sir?
Thank you very much indeed.
Thank you.
You're great.
Okay. My advice to the men out there who are thinking about whether they may or may not need to see their GP would be to tell somebody, tell your partner, tell your mum, your dad, your neighbour, and see what they say. And if they suggest you go see a GP, then you know what, you probably should.
We often find that with male patients, they have been sanctioned by somebody in their house to come to see their GP. But actually things have changed, I think, with the rise of social media and the awareness campaigns that are happening across the country. People are more confident, especially men, to come forward.
Have you tried giving up smoking?
I am doing. That's the 3 fags a day.
Stop it completely.
She must do a lot of things, but she's certainly not confused.
Take that as a compliment, I think.
I got assaulted 3 years ago, and it triggers me because I think he's coming back up the stairs.